But before we talk about our program here today around food, I do want to give our update on COVID-19 cases, testing, and hospitalizations. Yesterday, the state reported that almost 8 million new people were tested for COVID-19. In total, we've delivered about 1.3 million tests. Yesterday, there were 143 new positive cases, and that brings the statewide total to about 107,000. And the 7-day average for positive test rates remains at about 1.7%. There are currently about 513 people hospitalized for COVID-19 statewide, and 63 of those are in the ICU. The 3-day average for the number of patients in the hospital is down 86% since the middle of August. And as of yesterday, 4 hospitals were using surge capacity, but a lot of that surge capacity was med-surge capacity. It wasn't related to COVID. We'll obviously continue to monitor all of this data as we continue to reopen, but I do want to point out that when we reopened under the plan that was developed by our Reopening Advisory Board, the Lieutenant Governor, and Secretary Mike Keneally, we actually had a higher positive test rate 2.5 months ago than we have today, which speaks not only to the strategic decision-making that went into developing and implementing that plan, but it also speaks in a very big way to the work that's continued to be done by the people of Massachusetts to do the things that we know are most successful in containing the virus and reducing the spread. Wearing face coverings, distancing wherever you can, outdoors if you can be versus indoors, and taking advantage of every chance and every opportunity to spread the word and encourage others to comply with the rules that have been developed. And that, in some respects, is one of the most important elements of why I believe we've been so successful so far in containing COVID-19. I do want to talk a little bit about our Stop the Spread program, which we started on July 10th. That brings free testing to communities that have had high positive test rates in the past and low test results and lower numbers of tests lately. That initiative is up and running in 8 communities, including in Lynn, which is where we are today. The 2 sites in Lynn will be open through the middle of August. We know that targeted testing and tracing, combined with the things that individuals can do to stop the spread, can work. And in some respects, it's how Massachusetts and Lynn have been able to reopen at a point in time and continue to maintain the kind of positive public health metrics that we've been reporting daily now for almost 3 months.